Something that we see in the clinic all the time, and a lot of questions we get about this condition, is what's frozen shoulder and what can be done about it. So frozen shoulder or adhesive capsulitis is a condition that can involve a fair few structures in the shoulder. It doesn't have to involve them all at once, and it can involve just one or two of them. So typically you have an inflammation of the muscles or a tendonitis, a tendinopathy, inflammation of the bursa, which is a little fluid-filled sac that allows the tendons to move over it. So it's when you get an inflammation of that, or you could have a tearing of some of the muscles, you could have calcification that's being laid down. So frozen shoulder is basically an umbrella term for a problem with the shoulder. You typically see patients with reduced movement of the shoulder, so they're unable to lift their shoulder out and up or put their hand above their head or behind their back. So those movements are typically what's sore in frozen shoulder. And depending on the reason for the shoulder, we would then pick a treatment technique. So we may use cold laser, we might use shockwave therapy, we might use some rehabilitation exercises and movements. We'd use some soft tissue techniques to help reduce the inflammation around the shoulder. Dry needling's fantastic, as well as kinesiotaping, which helps promote the movement of the shoulder. We'd obviously give the patient some exercises to do at home, which is gentle movements to promote that movement and that normal biomechanical movement of the shoulder. Sometimes it can take quite a while for the shoulder to settle down depending on the cause, but prognosis is good and treatment outcomes are usually fantastic.